Graham Brady. He's chairman of the 1922 Backbench Committee of Tory MPs and joins us now. Good morning to you, Sir Graham.
Good morning.
Good morning. So much incredibly good news around about how we are tackling coronavirus, not just more new treatments, which can massively prevent not just death, but also length of time people are having undergoing mechanical ventilation and other serious treatments in hospital, but also the rollout of the vaccine running at a pace. 1 in 5 of all adults in this country now already vaccinated, all over pretty much, all over 70s plus, and the most clinically vulnerable have now been offered the vaccine. We are looking at an incredible achievement there. And we were told that the vaccine was a game changer. So why do we still have a government that has not announced an exit strategy from lockdown? And advisors on SAGE and Nerve Tag in Public Health England talking about us socially distancing, wearing masks and having restrictions, some of them for as long as another year or more. What's going on?
Yeah, well, first of all, I'm having some internet problems, I think, so I hope things aren't too
We can hear you
clear.
just fine, don't worry.
Excellent, good. Well, the government has said it's going to set out a roadmap. It's going to do it. The Prime Minister will do it, I think, on the 22nd of February, a week on Monday. So that's a positive development to look forward to. It will be, as you say, in the context of that tremendous success of the vaccination programme. The number of people who are vulnerable to COVID who've been vaccinated is extraordinarily high. In some of the older age groups, I heard up to 96% of people have been vaccinated. And that is meant to reduce the risk of mortality by nearly 90%. So this is becoming a much less dangerous virus, and we're seeing the number of new positive tests falling dramatically. We're seeing the number of hospital admissions falling, and we're starting to see the deaths from COVID also falling. So the context in which that announcement was made will be a positive one, looking forward to further rollout of vaccination as well, and a seasonal fall in the virus too, I should think. So it does seem odd sometimes that the advisors that keep popping up on the television, the radio, keep telling us to be even more despondent and that we really shouldn't look forward to anything later in the year. I think my reaction hearing the suggestion that we should still have social distancing in the autumn is to say, well, if that is the best advice, then give us the best advice. Let's, alongside the rollout of the vaccine, also look towards a return to that old-fashioned concept we used to know before this time last year called personal responsibility.
Oh, that'll never catch on, Sir Graham. Don't be silly. No, but this is it. It won't catch on with the government and with many who support a lot of these restrictions, because they seem to come from a view, and certainly the scientists, a large amount of the scientists on SAGE and Nerve Tag, and they're like, they seem to come from a point of view that they themselves don't need to be told what to do and need rules because they're responsible. But the rest of us, plebs, us peasants, are apparently too stupid, too immoral and too irresponsible to do what's necessary to keep ourselves, our loved ones and our neighbours and our colleagues safe. There is a real sort of a sort of one rule for us, one for them sort of view. This idea that we're all too irresponsible and stupid to do the right thing if we're just told to do it, as opposed to if there's a law.
Yeah, well, I wouldn't even go so far as telling people to do it. I think giving people good advice. Yeah. We need to remember that government is there to serve the public, not to tell it what to do. We need to get back to a world where we do expect people to take responsibility for their own lives. And one of the really difficult things, I think, to unroll after this dreadful year of endless rule changes and instructions and arbitrary rules being enforced, sometimes very heavy-handedly, will be getting back to the expectation that we're all responsible for ourselves and for others. And that's a really important principle to re-establish.
We know that we're going to be stuck in this for certainly at least another month plus. Let's be honest. The Prime Minister, earliest he's going to speak is on the 22nd of February, say Monday week. He said he'd give 2 weeks notice for school. Schools would be first to come back and he'd give 2 weeks notice for that. So March the 8th. And I know a lot of your colleagues and yourself have been saying you want that set in stone, that isn't pushed back any further. It's already going to be more than 2 weeks after the Scottish schools go back. But that will just be some years possibly from primary schools, only primary, not secondary. And then it's a long road back to opening retail, restaurants, pubs, travel, and all the rest of it. We are on a very, very, very slow road back at a time when we were told the vaccine was the game changer. We have seen already the deaths are plummeting. We have seen deaths plummet among the group who've been vaccinated at a far greater rate than those who've not been vaccinated, over 80s versus under 80s, which suggests it's not the lockdown doing it, it is the vaccination programme itself. The vaccination programme has rolled out at a speed to a number of people and had more effect than anyone's wildest dreams could have hoped for. And yet, the government is still shilly-shallying around about when and where we can come out. Given that we are now going to be facing a situation with a disease that is, to all intents and purposes, going to be a possibly pretty bad or possibly even moderate flu season in terms of the deaths that it can cause, and because we know about the treatments, we know about the protection from the vaccine and all the like. Given that we don't go into lockdown every time we have a bad flu season, can there be any justification at all for any restrictions at all on anyone's lives in any way, businesses' lives, education or anything, once the vaccine is rolled out to the 70 plus age group, one jab only, and that would be, by the way, this weekend, given the amount of protection that gives? Can there be any justification for any restrictions?
I think it gets a lot harder to justify restrictions. I think at that point, again, we can say there are those people who, for whatever reason, are more vulnerable than others, and they can make their own judgments if they want to be more cautious. Also important to say that we don't have to be going immediately to a complete removal of all restrictions, in that the regimes that were put in place last year, operating until just a few weeks ago, which were deemed entirely safe, to make sure that retail can operate with some distancing, with better hygiene, possibly with limited numbers in a shop at any one time. The restrictions that have been put in place for the hospitality sector, with more distanced tables, possibly only serving people at tables, and again with a much better hygiene regime. These were all things that were meant to create a COVID-secure environment for those businesses to operate. And so we ought to be confident that we can move back to that COVID-secure environment for those businesses to operate, and we ought to be able to do it really quite soon. I just make another plea on behalf of the aviation industry. Very important in my constituency. We have Manchester Airport just down the road, and I was talking to some people from the airlines yesterday, some of which are saying they actually need a very long lead time on this occasion to get back into the air. They need about 3 months because they've had some of the airlines, all of their aircraft on the ground for 11 months, not flying. They need servicing. They've had pilots, some of whom have been delivering pizzas for many months rather than flying aircraft. They need to be got into simulators for training to make sure they're safe to fly. So a lot of these things aren't things that can be a switch that's flicked. What we need on Monday week, on the 22nd, from the Prime Minister is some clarity that allows that planning to take place. Yeah. Because certainly for aviation, if they don't hear quite soon some definite dates, then it's impossible to have that 3-month lead time to get back for a summer season.
Yeah, and again, we need to have
some. If they don't have the summer season, there are a lot of jobs that are going to go.
Absolutely, well, there are an awful lot of jobs that are going to disappear, as we know, many businesses, and we've been talking to Robert Halfon, one of your Tory colleagues, about the effect on children. If the government doesn't start releasing things, if on the 22nd of February, and I've still got no faith whatsoever this will happen. He doesn't say, right, schools are going to start going back, and in 2 weeks' time after that, this is going to happen. In 2 weeks after that, this is going to happen. I mean, again, I still think that's way too late. It's way too long a period. But even if he did do that, that would be something. If he doesn't actually announce an actual timetable where we actually come out of this to get back to normal, not a new normal, normal, no social distancing, no mask wearing. If you want to social distance and wear a mask, feel free to do so. The rest of us are going to carry on and live our lives and take our chances. If he doesn't do that, what's a Tory MP going to do, though, Sir Graham? What are you going to do about it?
I think we have to see that roadmap. That's the whole point of a roadmap, is to tell people where they are going to be going. So we're looking at, as we've already discussed, a much more benign set of circumstances relating to COVID. We're also looking at a period of nearly 12 months when people have been living with quite significant restrictions on their lives, a lot of people are struggling. A lot of people who've essentially been in their house for most of the last year, people who haven't seen their close families for many months, people who are in many cases watching their children regressing both educationally and socially, and the enormous damage that's being done there. I think that this is going to be driven by a public expectation. As people look around them, see that there is far less COVID, see the success of the vaccination program, maybe know that they themselves or their elderly relatives have been vaccinated, people are going to say, hang on, I expect to be able to do this, whether it be getting back to outdoor sports and recreations, certainly, especially for children, making sure that people can get together with their friends. And, it's already the case. I'm getting approached by people who are more elderly, who've had their vaccine, 2 shots in some cases, and their friend has had 2 shots of the vaccine. And they're saying, why are we not allowed to get together